following portion of Living Local DMV is sponsored by Ashburn Children's Dentistry. Welcome back. As a mom of a soon-to-be 10-month-old, I, like all parents, obsess over every single move and action she makes. But when I can admit I'm unsure that signs like drooling, mouth breathing, and extended pacifier use indicate. I have no idea what that indicates. But luckily, we have our resident experts here. Please welcome back to the show Drs. Lynda and Krystle of Ashburn Children's Dentistry. Ladies, it's always a pleasure. It's always a pleasure. And like I mentioned, there's so many things that we obsess over our children. Like, they do cute little things, like put their little tushes in the air when they sleep. But after talking to you ladies, it's cute, but it might be an indication of something. Mm-hmm. What do you tell parents when they come in and they say there's excessive drooling, they put their little tushes in the air? What does that indicate to you as doctors in this profession that, you know what, maybe we need to look into this more?
So a lot of times when the parents come and they say that, we're always looking and going, something is making them do that. And most times what it is that they're trying to get some air into their system, trying to get some oxygen into their system. So it's not normal for a child to be sleeping with their tush in the air or even their neck all bent back and things like that. So when a parent comes in like that, we want to ask them a lot of questions about how the birth was, what went into that, because sometimes you can get some tension in the body that can impinge on the nerves, and we want to ask them know about the breastfeeding if any of that is going on, and if it's not going on, why is it not going on if it's not by choice, and what else could be happening? It could have to do with the tongue function, and it's not necessarily a tongue tie because most people just jump to that, but many things mimic a tongue tie. Part of that is how well the nerves are working, because sometimes just the trauma of birth, which is natural even, can cause the nerves not to work as well as they need to.
Wow, wow. I'm telling you, this needs to be a university segment because I go to school every time. Dr. Krystle, you sent us an amazing graphic that I feel like I need to post in the nursery. So it's something for children 12 months and younger. What are the signs? And we'll pull up the amazing graphic to go through it. So some of these things seem pretty normal, like pacifier use under 6 months, over 6 months?
Over 6 months. So the reason why we're wary on the use of pacifier use past 6 months is because it starts to make the tongue lazy. And as we talk about every time we're here, the tongue is one of the most important sensory organs, motor organs that we have in our bodies. And if that's lazy, that's not going to allow the structure of the face to be built well, the teeth to fit where they should, along with other hosts of health issues as well. You know, a lot of mouth breathing could start to arise from that. It makes a child less likely to want to try different foods. It starts affecting speech, things like that. And then obviously the shape of the teeth and how they come into the mouth. So pacifier use is maybe a convenience for a child or for us, but some kind of, and parents, yes, but modern influences or conveniences aren't necessarily good for what the body needs.
I'm sure a lot of people are turning up the volume on that one. We threw the pacifier out at 3 months. We're like, no more of that, no more of that. And for children 12 months and older, what should we be looking for?
So 12 months and older, this is a variety of things. If you're looking at their teeth, if there are no spaces between their teeth and everything's together, that's a big red flag, because that means there's no room in the real estate, we like to say, or on the jaw for the adult teeth to come in, or there's no room for the tongue to be able to grow. So that gives us a hint. Gummy smile, open mouth posture, things like dark circles under their eye, and then behavioral things like they're overactive. Sometimes we've had patients say their kid is a bully or has been kicked out of preschool. So different indicators, aggressiveness, or just being even sluggish, things like that start to give us some hints that something's going on with their airway or just like their development in general.
Absolutely. And the warning signs, I think they change with every development. So we were talking about under 5, but what about over 5? Because I know at that time people are bringing their children in to actually look at their teeth. So Dr. Lynda, I wanted to ask, what are the oral signs we should be looking for?
So again, talking about no spaces between their teeth, they should be like picket fences between their teeth, spaces like that. And sometimes they have a gummy smile already, meaning their top jaw is not developing like it should. And sometimes they have like an open bite, meaning the back teeth touch and the front teeth don't touch at all.
Goodness.
And then sometimes at around 5 or 6 years old, they may have like shock teeth. Shock teeth is not a good thing.
No,
no. That's those are double
They don't look
rows.
good either.
Yes, that's absolutely right. That just tells you that the adult teeth don't have enough room at all.
Wow.
So, yes.
Wow. As always, what do I say at the end of every segment? This can be an hour long, but we have a QR code for everybody watching. They can get more information on how to contact you, how to make an appointment, and also they can go to dcnewsnow.com/growinghealthyfaces. Ladies, thank you so much. I owe you tuition money per usual. I so appreciate it. And it's always a pleasure. Always a pleasure. And the preceding portion of Living Local DMV is sponsored by Ashburn Children's Dentistry.